I've got home, bearing in mind I left you nearly 3 hours ago, we took this sample. Look, it is still swimming very, very strong. I haven't done anything to this sample. I've literally put it in the pipette, and look.
So portable scanners.
Yes.
We have.
This is it.
This is
Completely
wireless,
mobile.
and we are looking at Beth, who I think is pretty much empty. The good thing is this: we can also look at the sperm today of the stud dog and see whether that was a factor or we just missed the day. So the gel is there, and then lots of gel. You watching this, Maria? Yeah. And the gel is in, and I think we can already start to see some.
Bladder. That's this thing flashing in the middle.
So what's that?
The bladder.
The bladder, okay.
Careful. Don't choke, girl.
So this is not looking great.
No, nothing.
She's empty.
She looks empty.
Yeah.
What day is she supposed to be on? 6 weeks.
Yeah, she's about 6 weeks. But we felt that. So this doesn't turn out as great news, but
Nothing.
nothing in there.
No. By now we will be seeing spine. There's no spine in there at all.
Yeah.
She's not even absorbed, is she?
No, no sex. No pregnancy at all.
With Brexit and just the whole hassle of importing of dogs, and not just the importing process, but the drama of being able to select dogs that are of the suitable temperament for our clients. Breeding our own dogs is absolutely the way forward for us. So we're getting a lot more scientific about the process. Showline shepherds, to get them with good working drives is very difficult. So when we see examples like this, we celebrate it. We must be able to cater for all different types of client needs, and not all our clients want a strong, powerful mastiff like this, and that's why we make sure that we create options. When to breed is very important, to understand when the bitch is ready. But equally important is to understand what's going on with the stud dog. We don't stud out, we keep everything really mostly internal. But from time to time we do come across problems, and we're looking for answers. Here we want to look at the sperm quality and why we have this red discharge.
So at the moment, just talk us through what you're doing there.
Right, basically we just pulled it up onto here.
Yeah.
And we're going to put it onto a slide.
Okay.
And we're going to have a look under the scope.
Uh-huh.
And see what I'm expecting to see is probably pus.
Right.
Straight away. And then obviously we'll see what's going on.
Wow, they're very active. That's good news. Okay, so tell me what you're seeing here. So we've got active sperm.
There's active sperm, but they're spinning.
Okay,
They're
so I'm going to
going
ask you
around
first of all, just in sort of structured questions. So in terms of activity, These are a little bit active, very active,
Very
or
active.
very active.
Yeah, they're
okay.
very, very
So we
active.
have a very strong activity level. Okay. Then start to talk to me about your most principal concern and what you see.
Most principal concern is the amount of pus and bacteria.
Okay.
But that obviously could be where the dog is young and he's not had his pipes sort of flushed through enough.
Okay.
And then the second thing is that the sperm is spinning. For a sperm to penetrate an egg, it needs to be moving straight forward. These are spinning round in circles.
And that would that be due to the infection?
That's probably due to the infection and the immaturity of the sperm, where the dog's obviously not been flushed enough.
Right.
If he was regularly flushed with antibiotics, this would clear.
Okay. So you use the term flushed, and that flush is through internal oral medication.
No, flush is when you would AI, exactly how you've done there.
Yeah.
I would do that every couple of days alongside the antibiotics, and then you should see the sample start to sort of like lighten up and get lighter and lighter until there's no blood, and you should see this going down. You should see less pus, less bacteria, and the sperm will start to swim in a straight line.
It's really interesting. I've been someone that's been working with dogs for many years, and many times we focus incorrectly on LH surge and the bitch's ovulation, whereas what you're now saying is a lot of times we've just been lucky with young dogs that have just mated without being flushed out properly.
That's right.
Okay.
Definitely.
So in a nutshell, what you're trying to say is this: if you have a dog that you're planning to stud, it's a great idea for you, first of all, to call you. Tell us, who are you?
I am Charmaine Baker.
And what's the name of your...
Global K9. And obviously, a clinic or me or someone like me can sort of detect these sort of problems.
And
easily.
you travel to people as well, depending on location.
Yeah, depending on
you
location.
get there, they flush out. All right, okay. So now you've told me that my dog's sperm's like breakdancing instead of swimming like Phelps.
Yeah.
So you suggest a course of antibiotics.
Yeah, at
So-
least 10 days.
Okay, so for us, that if we now see this, what do we tell our vets?
You tell your vets that obviously your sperm is red, the sample is completely red, it's completely blood, that is infection in itself, and then obviously you can get the vet to collect, or you can take this video in, and obviously they can see the amount of pus and bacteria, they can see that the sperm is swimming in circles and it's not going straight.
Do you know the name of the antibiotics that would normally
You
be
would
used?
want amoxicillin.
Amoxicillin, right?
Amoxicillin, yeah. You
Amoxicillin.
need it 3 times a day calls for a dog of his size, and you would need it for a minimum of 10 to 14 days.
I like
and
that.
he would be flushed every, say, 2 to 3 days.
I like that. So, besides the swimming in circles, talk to me about these black dots that you're seeing in here.
The black dots is sort of more the pus and bacteria, so that is sort of like the dead skin cells and debris that's picked up along the pipes. But as you can see, the sperm now is trying to attach to that because the sperm would be feeding. So they're now sort of attaching to this. They're going to feed off that bacteria, and therefore that's going to make it die. And obviously, where it's swimming round in circles, it's just going to initially clump together because it's not so straightforward.
Interestingly, then, so scientifically, if we can then understand why the sperms are, this is a hypothetical, a hypothesis, that a sperm would be looking for an egg.
That's right.
We have what appears to be an egg, but is mucus.
That is,
so
bacteria.
One of the reasons they're swimming round is actually trying to penetrate the mucus because it's been full.
If you can see, these little ones, they're trying to attach to it.
Yeah,
But
and that
they're just
activity
spinning round.
from that pus would be greater and closer than the ovulation of the bitch. So very clearly, any type of infection like this is going to be give you zero
it knocks
chance.
the sperm off track because obviously they can't swim forward all of the time they've got this going on because they've got to try and obviously get through this sea of bacteria and
The
pus
term
that's showing on
cock
there.
blocking comes to mind here.
Absolutely.
Wonderful.
I know this screen's a bit harder to see, but look, you've got the red cells, which is obviously blood. And this is your sample still swimming over 3 hours after we've taken it.
So we didn't get the breeding.
No additives.
You know, there is blood in the semen, but
Nothing
at least we
added
know
into the
now.
sample
And
at
we
all.
know that all we need to do now is visit our vet, and he's booked in tomorrow for him to get the amoxicillin, and we will try again. But at least we've now identified why Beth didn't take.